So I'm Dave Wilson. I work for, next slide, I think. I work for, well, for the last few years, I've worked for Tameside Council. Initially as a social worker, but for the last 20 odd years in commissioning. Don't ask me what that is, or don't boo me, because most of the time when I tell people I'm a commissioner, it's that, yeah. What I've noticed over all those years is that adult social care, I've used an abbreviation there, probably shouldn't have used, adult social care, ASC, is often very good at innovating and co-producing and at being person-centred, but we're often very poor at engaging with research and researchers and utilising academic input and the rigour that that can bring to evaluate what we do and to review and share what we do. Next slide. And health are good at this, and you know, I've often sat in meetings where health colleagues have talked about it being evidence-based, and good on them. It's been interesting this morning hearing about some of the challenges that you guys in health have experience in terms of research, but it almost feels like in social care there's a whole nother layer of that. It's culturally not a thing that we've been very good at doing. You know, we've got 3 major universities on our doorstep, but we in Tameside, but we rarely, if ever, you know, have anything to do with them. And so I don't know why I did, but I just started sort of engaging whenever I could. I got involved in a little piece of research about funding a canal boat society that was helping people with mental health issues. I did some research with Manchester University around an app, a falls prevention app, and I did that with Rachel Duffy, who's going to be standing here in a few minutes' time, and some other providers in Tameside. And then I accidentally ended up being a co-author of a chapter in a book, which I haven't even read it. It was bizarre, but I actually wrote part of it. But the point being was that I tried to involve researchers and research in whenever I could in some of the work that I was involved in. So I suppose in terms of the context of this, I was unofficially a research champion, and then about 12 months ago this role came up and I became an actual research champion. And what have I been doing? Well, yeah, Caroline's right. I kind of set out not quite knowing what to do, but I've ended up doing some actual research. And how? Yeah, it is. I've still got to write it up. Oh my God! But in my day job now, I sort of review and work with people with learning disabilities who have been placed out of the areas that they're from and areas their families and communities are in specialist placements. And it felt that one of the things that was not happening when that happened was that the voices of family members, parents, weren't being heard or ignored or lost. And so I've spent the last few months interviewing family members about their stories, about their sons and daughters and how they ended up being placed out of area, often, you know, miles away, Birmingham and Lincolnshire and places like that. And it's been really powerful stuff, really some quite harrowing, difficult stories I've been listening to, but out of that has come some really, really rich information, and I'm hoping that when I get my act together and I start writing that up, there are some emerging themes coming out of that, unpreparedness perhaps being the main one. These are young people who are often known to children's services and have had diagnosis of autism and learning disability and what have you, but then suddenly they hit adult services and everything's new to them, families don't know what to expect, they don't know what to do, and that's often happening in a time of change where, you know, as they're going through adolescence into adulthood, lots of things are changing. I've been really struck as I've been listening to people's stories about the expectations and aspirations of young people with a learning disability versus our society's expectations and aspirations for young people without a learning disability. And there's a difference there, and that's interesting to me, and I think needs to be recognised in terms of practice going forward. Family knowledge not being valued or listened or heard. Big issue in there about good outcomes versus financial pressures. We know there are financial pressures in the mix, but perhaps they take precedence over good outcomes for people. and then what makes for good outcomes. Next slide, yeah. So, with Caroline's enthusiastic support and belief in me, I'm going to be producing a framework for best practice, apparently, based on research. I'm going to link that into the GMCA, the Greater Manchester Combined Authority stuff around social care, and particularly around learning disabilities. And part of that's actually to sort of demonstrate, well, look, this is what, it's a tiny piece of research. I set out with all these actually massive ideas, and we had to scale it down a bit, but part of it's about saying this is what research has the potential to do in social care, to influence policy, to influence practice, and then possibly to lead to further research. When I did the literature review was just nuts. I mean, when I last studied something, I was taking books off shelves and blowing dust off them and stuff, and now it's all like on computers. Anyway, it's been a really interesting journey for me. If only it had been 5 or 10 years ago, I would have been all over this and doing PhDs probably and stuff. But I'm not. I'm retiring.